I'm back in hall number 2 now and at Nemera's stand, and I'm joined now by the Chief Executive, Mark Hemmel. Lovely to see you.
Good to see you too, Dave.
How's it going so far?
Very good, very good. We had a very busy morning, I hear. I just arrived today, and it's going very well. Thank you.
Good. Now tell me, what does your company do?
Okay, what we do is we deliver drugs to patients. So we do delivery devices. That's what we do for a living. Asthma inhalers, insulin pens, auto-injectors, nasal sprays, ophthalmic devices, anything really to deliver drugs to patients.
Okay, so now the patients aren't your consumer. I assume your consumers will be the pharmaceutical manufacturers. Do you work together, I assume?
Yes, our customers are the big pharma companies, typically, but we think about the patient a lot. That's very important. Our slogan is actually, and thank you for leading me into this, our slogan is we put patients first. So our customers are very, very important to us, obviously, but really think about the patient every day. Because when we develop new products or we manufacture, we also think that there are people out there using our products every day. That's our slogan. We put patients first.
And I assume in terms of your R&D, you're always looking at better delivery devices. You know, I'm a physician by training, and, you know, particularly with asthma, we know that the drugs might be very good, but the patients aren't terribly good at taking them. And even with the best will in the world and some of the best delivery devices, they still don't get a great deal of active drug.
Yeah, this is a very good point, and we work with our customers very hard to make easy-to-use devices, to improve compliance, to make it safer for patients. You're spot on, it's very important to us.
What do you think is the gold standard then for your delivery devices? What do you look for? Is it to get 100% of the drug delivered? Is it to look at ease of administration, portability of the device that you need to take with you, or all of the above? Do I get a job?
Anytime, David, anytime. You're doing this perfectly. You could work as a salesperson.
Thank you very much. So what's on the horizon? What's new for you? Because obviously, you know, the market's growing. You've got international market. What do you have your eye on in the future, or can you not tell me?
No, I can tell you a lot of things. So first of all, ophthalmics is very important to us, and particularly in the preservative-free world. Space, I should say. The drugs, you don't want preservatives in your eye, and we've developed a really innovative solution to prevent preservatives to get into your eye, so preservative-free eyedroppers. That's an important one. Then we also have developed a new auto-injector that's very good for highly viscous solutions. You may know that the new biotech drugs tend to be very viscous, and they're hard to inject. Yes. It's tough, and we have developed an auto-injector that's specifically designed for highly viscous solutions.
Gosh. So again, looking at new products, I guess, the fact that these are highly viscous, the patients not being able to inject and so on. You're right, you are putting the patients at the heart.
Yeah, exactly. I'm happy you noticed, David.
I'm a very quick learner. Now, I know that you attribute your success to all sorts of things, don't you?
Yeah, and the one thing that I really want to highlight today is the quality of our people. I mean, this is all down to the people who actually, you know, run this business. And particularly today, we're on a show. It's about the salespeople. And I truly believe that we have the most passionate and the best sales team of the industry. And you know what I'd love to do, David, is take you around and introduce you to some of them. Would that work for you?
Yeah, sure. Do they know we're coming?
No, they don't know we're coming.
Oh, good. This is going to be a nasty surprise, isn't it?
Exactly. Okay. So let's go to see Manuela first. So Manuela.
Oh, hello. I'm David. Now,
Nice to meet you.
Nice to meet you too. Now, apparently you are a member of this, or not just a member, one of the most important members of this brilliant team. What would you say to that?
I don't know that, but I am in charge of all the communication. So I organize the booth, the communication on CPhI, etc.
So when it goes really well, he tells you you're doing a brilliant job, and when things might not... No, things always go well.
Finger crossed, but today is a good day for us, so I hope that it continues like that.
Well, today is a very good day for you because it looks great, so congratulations.
Thank you so much.
Okay, let me take you to somebody else then. Okay, Fanny, you want to come over here? Okay, I'd like to introduce Fanny.
I feel like I'm doing a surprise program on...
Sounds like it.
Fanny is in charge of the ophthalmic category. She's in marketing. And she's supporting the whole ophthalmic franchise.
Now, this is your big moment. So how important is ophthalmics then in terms of the business generally?
I mean, it's a great business for us. There is a huge market, and everybody needs preservative-free formulations to, not damage their eyes. So there is a real need from patients behind it.
Yes, and in fact, Mark weirdly had just been talking about preservative-free solutions for making sure that you have good eye health. So, and you see this as a very big market and an emerging market.
Yes, it's a big market essentially in Europe, in Latin America, and even the US market is switching to preservative-free today. So they are really switching now. So this is interesting also to see the switch.
Interesting, and you have a big job ahead, so good luck with that.
I'm busy, which is good.
Thank you very much indeed.
Thank you.
Okay, thank you, Fanny, and well done. Okay, let's see who's. Okay, here comes Raphael. So, Raphael.
Hello.
Okay, you want to say what you do, maybe?
What I'm doing here?
No, what do you do? What do you do within the business?
Okay. So I'm category manager in the dermal range.
Dermal.
Dermal.
Yeah, sorry.
I see. Okay, now obviously skin, you know, everyone, it's the quest for eternal youth going on at the moment. What sort of products dermal products do you do?
We do airless product, so I don't know if you want to show them.
Come on then, show us around.
Okay, so here it's our main product, it's a soft bag. So it's an airless system, so the air does not enter inside the formulation. So you only, when the formulation is extracted, no air enter. So for sensitive formulation, it's very good because you don't have contact between the formulation and the air.
Okay, so I assume, are you talking about the one here there's a testosterone?
Yeah,
Is that a testosterone one?
It's a soft bag product. Testosterone is one of the products we sell, but the packaging system is a soft bag system. Okay, and airless system has very good advantages because you can use them in every position, so upside down, and also so no contact with the formulation. And with this system, there is an aluminum pouch, so you can use it with very sensitive formulation.
Because that's one of the big bugbears, isn't it? When you have a dispensing system like that, and there's always stuff left in the bottom when the air enters, and you can never get this stupid stuff out, and it drives consumers crazy.
So this helps doing that because it helps emptying completely the system. We have restitution rate over 95%, so you can extract a lot of the product in the bottle.
Interesting. And I assumed, Mark, just talking to you, but going back to the testosterone, you're talking to manufacturers of testosterone products, are you? Because the ones I've seen come in little tubes, you know, that normally 5 milligrams or 5 mils or whatever.
Tubes, David, come on. No, this is a much more advanced solution.
And are there other companies that make these sort of products?
Not quite as good, though. And we're just a very small number of players in this market. We believe we are actually the global leader in those solutions, and we work with a lot of customers in this field.
Good. Well, we can have a chat offline about that. But anyway, thank you very much indeed.
You're welcome.
Thank you. Thank you, Raphael.
And do we have anyone else?
I'm afraid the other ones are all busy with customers, so I hate to disturb them.
Well, can I just say it's been an absolute pleasure to talk to you. I do wish you the best of success here at CPhI Worldwide, and I have no doubt with that charm you'll do very well indeed.
Okay, thank you very much, David. Thank you so much.